Importance of fever. So you are having a fever, and the quick thing for you to do, oh, let me grab paracetamol. Or sometimes when you call the GP will tell you, or your primary doctor will tell you, take paracetamol for the cold or ibuprofen. What is it going to do? It's going to block the natural way of your body dealing with either it's an infection that has come into the system. So immediately when you begin to have a fever, support the system. Don't block the reaction. As you support the system, the reaction will go down, because now it has what it needs to be able to fight the infection. Only last week my son came home and he said, oh mom, I'm not well, I've got a fever at work, and you could tell from his face he was so poorly. So I asked my daughter, help him to make flu bomb. So both of them, they went into the kitchen. They knew what to do. So he made it. The following morning, he said, oh, I'm well, I'm okay. So he did not take the flu bomb. I asked him, there is herbal tea on the hob, take some. He thought he feels better, so there's no need for the herbal tea. He went to work, he came back home with the same fever and feeling poorly. So he went back to the kitchen, made the flu bomb. This time about 500 to 700 mils, and he had to drink it throughout the night. So I gave it to him, and then we gave him herbal teas as well to take. The following day he went to work, and that's it. Everything settled. Although he's young, only 19, he's young. But what I'm trying to say, when you have the fever or you just notice that you are unwell, support the system. Don't block the reaction. Once you give the system what it needs, the reaction, it will go down. Why do we get fever? The fever, sometimes your body thinks, okay, this is a bacteria, this is a virus, let me cook it. So it's kind of raising your body temperature to cook whatever bug that has come in. Again, once you have the fever, then it activates your immune system to work vigorously. So your immune system is kind of giving a massive kick because of the fever, and then the immune system will work. So let's say I've got sore throats, and then I've been taking paracetamol. The moment it started, I'm taking ibuprofen, naproxen to calm the fever and the aches and the pains. I haven't done anything about the bug, whether it's a virus, whether it's a bacteria. I haven't done anything about it. I've just stopped the pain. Yes, your immune system is there to fight it, but sometimes what you do is that because you have calmed down the fever, the immune system is not strong. You haven't cooked the bacteria, so they are able to do whatever they want. Recently, research has shown that people who take ibuprofen and naproxen, anti-inflammatory medication, when they become unwell, it helps them, or it precipitates empyema. Empyema is whereby between your lungs and the cover of the lungs, in between there, you have pus, bacteria and pus filled over there, because you have stopped the reaction. So your body could not deal with it, and the bacteria has found its own way to go wherever it wants to go. So initially, when you become unwell, let us support the body, at least for 3 days. Support the body with good things, allow the fever, and then you realize that when you give a good nutrition and you give yourself the herbal remedies, all the natural stuff, your body will be able to deal with it. Coughing. We don't like coughing. Many people will come to the GP, oh, I had this chest infection, or I had sore throat, now I'm coughing, it's disturbing my sleep, I can't sleep, I need something to stop it. Many times you advise you might have to get over-the-counter cough mixture. Normally, majority will tell you it really doesn't work much. Or we might ask you, how long has it been going on? Maybe a week, 2 weeks, then we'll give you nasal spray, mometasone nasal spray. It kind of dams the cough reflex. It's a steroid. It dams it. Now, when we become unwell or sore throat or a bit of chest infection, we are coughing, what are we bringing out? We are bringing out the debris, whatever has caused us to be unwell. Your lungs or your airway has something, structures, which is called cilia. And so this cilia, it's kind of like a brush. It brushes upwards. It comes in a waves. That is what brings out mucus, so that we can cough it out. It comes into the mouth and then we spit it out. This hair, it kind of brushes, so it will trap, and then the mucus will trap any debris, and then we bring it out. So if I stop the cough, the trapped debris, I will not be able to bring it out, and then eventually the body will absorb it again. So I'm not doing my body a favor if I stop the cough. You want the cough to stop, assist the body. Assist the body. We will find out what we can do to assist the body so that we can stop the cough and at the same time assist the body to get well. If you would like to use the over-the-counter medicines to help you with a sore throat, many of them is just sore throat, but if it's a chest infection, it has gone down, we will advise you to take antibiotics. Many times they might not be bacterial infection. It might be a virus, especially if the sputum is yellow. It might be a viral. But you see, when patients call and you know that they just want something, telling them, go and do something, drink ginger tea or whatever, they don't want to hear that. And so you just give them the antibiotics. Many times that I've tried to explain why at least give yourself 3 days and giving advice on ginger and lemon, honey, stuff to take, and after 3 days, if it's not getting better, give us a call. The response I get, so you want me to go and suffer for 3 more days? And so if you throw this to a GP, he will just give you the antibiotics, which eventually is not going to help you, because it might not be chest infection, a bacterial infection, it is a viral, so the antibiotics is not going to do anything. Plus, the antibiotics will find its way into your gut and then destroy your microbiome. So you haven't done yourself any favor. One thing that we can do, especially for sore throats, if you want the over-the-counter medicine, is aspirin. Aspirin gargle. So what normally you put 2 aspirin in water, let it dissolve, and then you gargle it. That will help you with the sore throats. These days, that is what I normally advise patients to do. Do it for 3 days. If it doesn't settle and you realize that the cough is very chesty, give me a call and then we'll give you antibiotics. So aspirin gargle, but remember, aspirin is anti-inflammatory. So whatever symptoms that you are having, it is your body's natural response, and you are using the aspirin to stop it. There's another one, Difflam spray. Difflam spray is also anti-inflammatory. Normally, if you cannot swallow, I've got sore throat and because of that I'm not able to swallow, okay, use Difflam spray. Again, it is anti-inflammatory. So it will stop the sore throat, the pain. But the actual issue, the problem, it will not treat it. Thank God we have an amazing immune system. Sometimes, despite all of that, your immune system will be able to kick in and do what it's supposed to do. But it will be much better if at that time we support the immune system rather than stopping its activity.